So I was very kindly asked to chair the opening new named symposium for therapeutics at BTOG 2023 here in Belfast, and it was a really thrilling session. Actually, 3 excellent speakers, all very complimentary of each other's talks. So Martin Forster kicked off with what we call tumor infiltrating lymphocyte talk, and they were personalized. So what that means is that we take blood or tumor sample off the patient, we stimulate it with a particular target, get the immune system in that cancer going, and then it's infiltrated back into the patient to stimulate their own immune system. So this has been going on for a long time, but this is really the first time where we've actually seen some tangible improvements in early phase studies in patients. So that was really exciting. There's lots to come in the future on that. The second speaker talked about a really fantastic study which is going on in the UK, and this is looking at rare mutations. So it's tumor agnostic, not just lung cancer. And that's really important because we need these big sort of sites who are conducting these studies so we can all refer patients in when we detect these rare mutations. So it's all about the diagnostic side, because if you don't look, you're not going to find, and they're pretty rare, so if you don't look, you're not going to find. So, and the really good piece about that was the European collaborative work. So the same similar basket studies are being done in lots of places in Europe, and there's a whole collaboration despite us Brexiting, so it's nice to see that research can still be collaborative throughout Europe, and that's a great incentive. And then the third talk was Colin Lindsay's, who's a researcher with interest in particular KRAS mutations and large cell neuroendocrine tumors, and his main thrust of his talk was looking at co-mutations. So what do we do when we find 2 mutations? Which part do we treat? What's the landscape there? Does it actually impact on clinical practice? And currently, these are all areas of research. So, tomorrow in my clinic, if I see a co-mutation, I won't have any actionable, tangible things to do, but I will have trials that I can refer that patient to, perhaps not in my center, but elsewhere. And I think all clinicians need to be aware of these so that these rare mutations can be acted upon in trial setting. So that was a really good starter to look at those therapies.